Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome everyone. I am Safa Faraj from University of Benghazi, Faculty of Medicine. Thanks for the organizer of First International Scientific Conference, Faculty of Nursing, Mansoura University. Today we are going to talk about promoting resiliency in first responder, the essential role of nurses in sustainable post-disaster mental health support. Actually, the important question here is not what we are going to talk about. The important question is why we are going to talk about this topic and why it's important. Let's dive in. As we know, first responders face heightened psychological risks following disaster response, with post-traumatic stress disorder and related mental health conditions emerging as significant concern. The 2023 Derna floods in Libya provided a case study of these impacts in an Islamic cultural context, revealing both challenges and coping mechanisms employed by responders. This qualitative research explored coping strategies among first responder post-disaster, while highlighting the pivotal role that nurses can play as caregivers, advocates, educators within responder organizations.
So understanding the context of Derna, we have to now look at the cascading effects of when people are victimized or traumatized. And we recognize that there's the actual risk of having been there, but then we have to understand that there is an illness or an injury of trauma which induces suffering. And this could lead to financial burden or social burden to the individual, to the organization, and to the society. And then that leads to secondary ailments where people's physical health might go by, or an organization's health gets reduced. In our cases, first responder organizations aren't able to do what they need to do with a workforce that is not ready for work. And that leads to more vulnerabilities for the community. So this is where we can push back and think about the chain of survival behaviors, which is not the chain of survival. This is around first aid, and we start with prevention. So how do we help people recognize when trauma could be there as an organization, so we can either get people out of that situation or give them tools. So that leads into the plan and preparedness. And then as clinicians, we need to understand where we can recognize psychological trauma early so that we can provide some first aid or professional help if needed so that they can get to recovery. And if we do this in a systematic way, then resiliency is available then for that community.
And regarding the methods, 18 first responders were interviewed. The data collected included demographic data like age, gender, marital status, residency, and occupation. And we used BCL4 to assess post-traumatic stress disorder symptoms. It's important to highlight that BCL4 is a screening tool rather than a diagnostic tool. And we asked about description of post-return experiences and coping mechanism employed by responders post-Derna floods. After analyzing the data, we found that most participants accepted possible or probable post-traumatic stress disorder symptoms, with coping mechanism was ranging from adaptive like self-destruction, religion, social support, to maladaptive like avoidance and isolation, as shown in figure. Social support from healthcare peers was consistently cited as beneficial. However, professional mental health consultation was rarely utilized, and stigma about trauma-related care remains. Routine assessment for trauma exposure in health histories is rarely conducted, limiting timely intervention. So, the difference between groups showing comparison between years of experience, which suggests no significant difference of PTSD risk. On the other hand, we found longer exposure to the disaster increased PTSD symptom made due to cumulative stress effect. And ending with the last group, the comparison was between occupation, demonstrated unique strategies. Doctors preferred communication and acceptance, while support staff rely on active coping and isolation more frequently. Despite these differences, doctors and support staff showed comparable levels of PTSD risk.
So recognizing those barriers, now we have to get into what can we do through the role of nursing. And two theories I want you to play with. One is the trauma-informed care model, which we as clinicians have to think about in the terms of recognizing, being able to screen individuals and groups in our case, then respond appropriately, and there's a set of tools that are there within our training system, and be able to refer them on to professional care. And that is all with the idea of empowering the individual to take care of themselves and obviously the people around them. Now, this isn't just a one-time event. We have to put this in the terms of where people are in the disaster cycle. So the disaster cycle can start anywhere, building this process, but nursing needs to be in the leadership role during prevention. So how do we work with workforces of first responders and give them the tools to recognize traumatic situations and to be prepared then individually and as a group to manage that trauma and respond to it appropriately during the event, and what we're talking about today is after the event. That is ultimately going to lead to the recovery of those people so that they can become that viable workforce in emergencies that nurses could be a part of, firefighters, police officers, local citizens who are helping. And so when the role of the nurse, we have the tools to help the individual and the organization with the trauma-informed care, it then has to be placed in each of these different levels or these different areas of the disaster cycle.
Nurse-led initiatives, including targeted training, structured peer support, and integration of psychosocial resource navigation, can dramatically improve long-term outcomes. In conclusion, sustainable healthcare for first responders requires an integrated approach in which nurses are empowered as frontline advocates and educators. By supporting ongoing recovery and resilience, nurses ensure both individual and organizational capacity to respond effectively to future disasters. Here is an implementation steps. First, train nurses on psychological first aid trauma screening and local resource awareness. Second, embed screening tools in responder health assessment. And then establish nurse-led peer support and referral networks. And lastly, advocate for routine pre- and post-event mental health checkups and baseline data collection.
So our take-home message is that we have a resilient nursing workforce that has the leadership abilities, the clinical abilities, and the humanitarian abilities to help prepare organizations and first responders for the traumatic impacts of a disaster. And that is ultimately going to benefit patients, responders, and the healthcare systems. And if we support those who care for others, we strengthen the fabric of the entire emergency response capability for our society. Thank you.